But what the minimally invasive techniques do is they create a lot less pain, a lot less risk with the surgery.
Now to a story of a South Florida man looking to rid himself of some serious back pain. In fact, the pain was so bad that when nothing else was helping stop the pain, he opted for a surgery that would not only fix his back, but also speed up his recovery time.
First of all, if I did an MRI on 100 people who never had pain in their back or leg, 30 of them would have a major abnormality on that MRI, such as a herniated disc.
It's a startling statistic. 30% of people have a serious back problem and don't even know it. And the reason why is because most of the time, we hurt ourselves doing things we do every day.
Very often, it's a minimal thing, like leaning over to brush your teeth, that'll start these symptoms going crazy.
56-year-old Glenn Frederick is a prime example. The common man, a carpenter from Key West, who hurt his back in a very unusual way.
There was nothing dramatic about it. It was, I fell asleep in a computer chair with my back unsupported and woke up with a really bad back pain.
Isn't it ironic that you can have a heavy laborer who's swinging a hammer all day long, working as a carpenter, do something as simple as fall asleep wrong in the chair and wake up with bad leg pain? But that's the way it happens very often.
Dr. Kalman Blumberg was one of the first doctors in South Florida to perform this procedure.
And the idea of the minimally invasive techniques is that it's much less disruptive to the tissues of the body. Patients get up and get going a lot quicker. They get back to their normal life or back to work much quicker. So that's the advantages of doing minimally invasive surgery and using minimally invasive techniques.
And for Mr. Frederick, he just wants his life back.
Sitting down's a pain, driving's a pain, sometimes walking is a pain, so it's it's a pain in the butt, quite literally. That's where we're at. So
we make an incision in this area here, and in these two bones, what we have here are two vertebrae. And I can move them just a tiny bit because there's this implant here that holds them stiff. We place the pins here and we distract, and that allows us to get into the spinal canal here where the nerves travel and open up and remove anything that's compressing those nerves. And that gets us in between the two vertebrae to visualize the nerve roots and remove everything that's compressing them. Once we've done that, we place this bone graft and we place this fixation device, and that makes this one vertebra heal as a solid post to the next. That's called a fusion. And the hardware, or the purple implant device here, holds the spine in the proper position and holds it very rigidly, which gives us good alignment. And that's it, done with the operation.
they said there would be, tangible results within, by the time I had been discharged, but I didn't expect it to be right after surgery.
But before you learn to run, you have to learn to walk. And Glenn now has to go through physical therapy to preserve the surgery from more injuries.
All right, here we go. 1, 2, 3, straight on up.
Oh, I love it.
Beautiful.
Oh.
Good job, Mr. Frederick. Awesome.
Glenn Frederick would be discharged just 2 days after surgery, and within a week was able to walk with very little pain to no pain at all.
And therein lies the miracles of modern medicine. I love it.
Who hasn't had back pain? And we're very lucky right now to have Dr. Blumberg with us right here. And my wife was suffering this week. She was walking around all week. It's awful. But some of the things we're learning about back pain, and I never knew this, smoking is a risk factor.
Absolutely. Smoking is a risk factor, and it's mostly a risk factor for chronic back pain. Anybody can injure their back once or twice, but the healing of an injury is very dependent upon oxygen tension in your blood. And when you deliver carbon monoxide and nicotine to those healing areas instead of oxygen, then you never really heal those areas properly. And it can, instead of healing like a rubber band, it can heal like a cookie. And it's at very high risk to be injured again. So.
Yet another reason why to quit smoking. We'll be right back.